I'm Dr. Michael Budincich. Today we're going to talk about sciatic nerve pain. What is the sciatic nerve, where it's at, and why it causes the human being so many problems. Here you can see a spinal model with a cutaway. If you can see this yellow trunk coming down here from the lower back, this is actually the sciatic nerve. It comes out right out of the buttock. And so a lot of people start out with sciatic nerve pain just in the buttock, and it does not go down. And then as it comes out of the buttock, it goes down the back of the leg, down this way, and sometimes into the calf, and sometimes even into the lateral foot or large toe. So the milder a case of sciatic is, the more it's centered around the lower back and buttock. As it becomes more advanced, such as in a disc protrusion or a disc herniation or disc sequestration, the pain will radiate to the knee and then maybe all the way down to the calf, ankle, and foot. So the sciatic nerve is actually a compilation of 5 or 6 different nerves that come from the lower back and the sacrum, and they all branch together. The most commonly pinched nerves that cause sciatica from a chiropractic standpoint are the L5-S1 area, or the S1 nerve, and the L4-L5 level, which is the L5 nerve. Those two nerves probably comprise 95 to 98% of all sciatic pain. So if there's a pinched nerve here or here from arthritis, spinal stenosis, degeneration of the disc, uneven leg length, or a bone out of place, that will manifest this pain into the leg. Sciatic pain is usually worse when you sit, if you have a disc problem. If you stand a long time, it can also irritate it. If you stand a long time and you have sciatic pain, it'll typically be from spinal stenosis. When you sit a long time and get sciatic pain, it's typically from a disc bulge or protrusion, because that will make the disc bulge out worse as you sit, because it doubles the pressure from standing. So sciatic pain, probably one of the top 2 conditions that a chiropractor will see during their career. We've been here 34 years. I can tell you conservative, we've seen at least 5,000 to 10,000 cases of sciatic dysfunction, and most of them get better or well. When they don't get well, it's usually a very large sequestrated disc or protrusion. Occasionally that needs and it may be an injection with a corticosteroid, and very rarely even occasionally surgery. But from our experience, maybe only 1 or 2 cases out of 100 might possibly eventually require surgery. So if you're suffering from sciatica, always see a chiropractor first, not last. Get checked out. Usually that will resolve your condition within a period of 1 to 3 months. Don't expect a miracle overnight, because it takes time to get well naturally. If you're looking for a magic bullet, then surgery might be the way to go, but then there's no going back, and you also will have a recovery from the symptoms of the surgery, which could take months, or it may never recover. So in wrapping up, sciatica is very common, very treatable. You need to see your chiropractor first.